Hello, my name is Michael Moran, and it is my good fortune to be spending time with Dr. Satish Gupta, a very well-known cardiologist and the author of a wonderful research study that is popular worldwide called the Mount Abu Open Heart Trial, which we'll be talking about a little bit later on in the interview. But first, I'd like to welcome Dr. Gupta. Thank you for being with me and taking the time to conduct this interview today.
Thank you.
When I came in, I was thinking this was the first time that we had met, and then you reminded me that it was almost exactly 10 years ago that I was up at Mount Abu, visiting the hospital, and we met at that time.
That's right.
So it's good to see you after 10 years and to see all the progress that has taken place here with the Brahmakumari. I would like for you to share a little bit about what it is that brought you to the Brahmakumari. What was the story that brought you here and got you so enmeshed in this philosophy and way of life?
See, basically, I was a practicing cardiologist in Delhi, and a busy cardiologist in Delhi. And then I started, because in Delhi, we used to see lots of heart patients coming with, the blocks, the angina, the heart attack. And, we'll manage the patient and then subject the patient to angiogram, a coronary angiogram, and find the blocks and fix the blocks, either with angioplasty and stenting or with a bypass surgery. What I started seeing was that the disease had started as compared to 80s, in the 90s, the disease had started coming in the early 30s and 40s, which used to come in 60s or 70s.
You called it the aging disease.
We used to call it a degenerative disease. Comes with age.
Right.
And comes to high class, higher socioeconomic status. But now we started getting patients with in the middle class, lower middle class, and the lower socioeconomic strata group also. And people who were farmers, laborers, so those people started getting heart disease. And, it alarmed us, all of us, we were alarmed at seeing the what is happening. And we have been talking all about the people who have hypertension, who have more diabetes, who are smokers, who are obese, overweight, who have more high cholesterol, who are sedentary in nature, lifestyle is sedentary. So these people get more heart attacks.
Now, was this something that you noticed happening just during a period of time that hadn't been happening before?
Period of 10, 15, 20 years, we started seeing, this type of thing happening. There was change, paradigm shift was seen.
Yes.
That why this new group of people are coming with without anything, developing heart disease at a younger age, and they are taking right diet, they are doing exercise, and what is causing the disease? What is responsible? And when we used to fix the blocks with angioplasty or bypass surgery, they'll come back with the same problem after 3 months, 6 months, 1 year. So that was a big problem.
Yes.
And middle class person cannot afford 200,000 rupees every time. So that used to put me to stress. So I kept on thinking about it, and then because I was practicing rajyoga meditation since 1986 when I was at All Institute of Medical Sciences.
Rajyoga meditation through the Brahmakumaris at that time?
Brahmakumaris, yeah.
Okay. And how did you find that center, that first center for the Brahmakumaris?
See, I came to the, though I had a hospital, practicing in a hospital, I had my own hospital in Delhi, and a very, very, very roaring practice, very busy practice. And I used to think that I'm doing a lot, very busy, being very busy day and night, not even getting time to have my lunch, dinner properly. And not having,
very high stress job.
Yeah, not having time to meet my wife, my son, my parents frequently. So all the time busy with the patients. And then one fine afternoon, I was invited for the inauguration of an exhibition by Brahmakumaris.
At your hospital?
No, in that area. Local
in that area. Okay.
Local area.
Yes.
So when I was, cutting the ribbon, then that thought the thought came which never had come to my mind, that what you are doing, doctor, can you treat the whole world with this? So, and kept on ringing in my ears. So then I said, no. I asked myself, can I do it? I said, no, I can't do even 0.1% of what needs to be done.
It's even in front of me now.
That day was my birthday. So it was 15th of Jan.
What a gift you were given.
Yes.
This idea. A big idea.
Big idea. So then I went back home, kept on thinking about it, having my lunch and still kept on thinking. So I realized that what I am doing has to be stopped. I have to go for bigger things. So after 20 days, I left my practice. I closed my hospital and then planned further studies and got my further studies in All India Institute of Medical Sciences, Delhi. So one day while going, for a evening out, I was going with my wife and my son. Then on the way, we got this Brahmakumaris center. And as we entered the center, the very first thing that you are a human being, but you are a being with the human body.
A soul having a human experience.
Yes.
Yes.
You are a being with the human body. Previously, we used to think that we are a human body with a being.
Yes.
But then that thought that how the being makes the body function. When the being is out, body is dead. So that thought, really clinched me because it became so scientific. And who is the supreme being? Supreme being is the one which keeps nourishing the being.
Mm-hmm. Mm-hmm.
Very, very, scientific, very logical. And that really clicked on. From that day, I started practicing rajyoga meditation, and almost all the problems were solved, all the questions were solved. And since then, I started doing this regularly meditation. I was using not only for myself, for my family, for my patients, and gave very good results.
I want to go back to it really interests me when somebody makes a radical change in their life.
Yes.
Because you were a very successful cardiologist, you were head of a hospital, you had an idea that came to you that can you do this for the world? And within a very short period of time, you left all of that behind and invested yourself fully in this new path.
Yes.
I get chills even thinking about that because that takes incredible faith. What was the feeling when you heard that, and what made you say, okay, I'm going to leave this life behind and now I'm going to fully invest in this?
See, I was very convinced that I can't, what I'm doing is not enough. Because from very beginning, I used to always think about the thoughts, how thoughts can cause disease. Because after my MBBS, after my medical school, I read a lot about psychology and how psychology relates with the diseases. Early sort of formation years in the medical hospital, I used to always try to correlate, disease and thoughts. And I used to sit with the patients, talk to the patients, and I used to see that patients get relief. I will keep on sitting with the patient the whole night sometimes,
Yes.
and trying to solve their personal problems and the thoughts which cause the disease.
Right.
So next morning, my professor will see there's a drastic change, change in the patient's behavior, patient's attitude, patient's symptoms. He will say, Dr. Gupta must be on night duty. So he is the person who does hard work with the patients. So he's the only one. That is what made my belief strong and strong.
One of the things I heard many years ago that really clicked with me, because a lot of people think that the world happens to them, and not thinking that it's their thinking that's causing us some of that.
Yes.
And I heard many years ago, thoughts held in mind
Yes.
will produce after their kind.
Yes.
And so that we can take control of our thinking and change our experience of life.
Yeah.
And as you're saying, even the health of our body.
Yeah. Consistent thinking patterns lead to experiences.
Mm-hmm.
And experiences lead to life.
Yes.
Right? Life is made of experiences. And the experiences, good experiences give health, and bad experiences gives you disease.
Yes.
Dis-ease, loss of ease. First in the mind, then in the body.
Then in the body. You left your practice behind, and then what was next?
So then I was introduced to Brahmakumaris,
Mm-hmm.
maybe 3-4 months after joining my new hospital, where I was doing researches in this area. So then once, I got that thought and it started relieving my stress. And then, after completing my further education and further researches, then I became a, full-fledged cardiologist
Mm-hmm.
and joined one of the premier institutes in Delhi, a cardiac institute. And there I started seeing these type of patients who were getting heart disease at a younger age, people who are stressed, people without conventional risk factors, that means without hypertension, without diabetes, without smoking, people who are doing exercise, still getting heart attack. So then my interest became more and more into this, that how the disease, how the blocks happen, other than what is mentioned in the books.
So somebody can be practicing exercise, proper diet, and all of those, and still
get
what
get triggers heart attack. What was basically the thing was that we knew the causes, what leads to progression of the disease, but what triggers heart attack? So that was one of the most important things we were looking for. So then we thought that, then we found that, as I sort of interviewing patients, talking to the patients, talking to the relatives of the patients, then we sort of could come to a conclusion. The stress, which people used to think that stress is one of the factors in causation of heart disease, and which is probably not modifiable. And then I said, the stress, the psychosocial stress is the factor, central factor around which other factors are playing role. Diet, exercise, smoking, alcohol, late nights, the other factors
all contributing.
Are contributing. The main factor, the pillar is stress.
So how do we relieve that stress?
Yeah. So after that we had little because I was daily, we used to do meditation, and meditation is a two-way process, right? Prayer is a one-way process. You talk to God and that's it. God doesn't talk to you, right? It's a one-way process. But meditation is two-way process. You talk to God, God talks to
you.
Through thoughts.
I love, before we went on the air, we were talking, and you were talking about when you went into the meditation room and you were starting to conduct the study at that time, and you had a vision. Tell that story.
See, vision was basically, day was also, I can remember the date. It was 26th of Feb, 1995. So, because I used to think that in the blocks happen, and some people have the blocks at an early age, some people have multiple blocks, some people have only one block. And with one block, the heart is dead, and the ejection fraction becomes very less. In the contracted power of the heart, from 60% it becomes 25%, 20%. And in some people who have multiple blocks all over the heart, maybe 5 blocks, 6 blocks, 10 blocks, the heart keeps on functioning nicely. Person doesn't have a heart attack. Those first vision, I was given this idea that the disease happens, the soul, the spirit, the being keeps on nourishing various organ systems of the body with energies, innate energies.
Yes.
Peace is energy. Love is energy, right? Happiness is energy, right? These energies are wonderful, subtle energies which every cell of the body requires, right?
And those are expansive energies.
Yes. So they make life happen. Without them, the life becomes...
Yes.
Life is no life. One feels, he may be having a lot of money, a lot of resources, but if the peace is not there, love is not there, happiness is not there, I think every viewer will agree with this, that the foremost essential things in life is peace, love and happiness.
Absolutely.
They are not available in the market. That is innate to us.
They cannot be bought, but they can only be experienced or expressed.
Yes. So, and they are innate to us. So what is happening in the humanity today is that we are losing this. A person, in spite of the affluence, is losing the peace, the inner peace, the real love, the so-called unconditional care. Love means unconditional, dignified, respectful care for everyone. That is the meaning of love, right?
And isn't it interesting that when love is, when we refer to somebody that is not experiencing love, they would say, my heart is broken.
Yes, yes.
I have a broken heart, or she or he is broken-hearted.
Yes, yes. See, basically what is hurting the heart today is conditional care, conditional love.
Yes.
That breaks the heart. Conditional. There are certain conditions and clauses are there to have that love. So to have that continuous care from the fellow beings around us. Maybe relatives, maybe parents, maybe the spouse, maybe the children. It's a conditional, right? And that breaks our heart.
You know, Mother Teresa said something that I have quoted many times and think about, and she said, the reason we have no peace in the world is because we have forgotten we belong to each other.
Yes.
That we are family.
That is what spirituality is all about.
That is, yes.
Because this is where we connect with everyone in the world. Because spirit, that is unique. See, peace, love and happiness is beyond language, is beyond caste, beyond creed, beyond religions.
Yes.
So that is unique to all of us, and that is the innate energy of being. That is something which is there inside. But when we become too much materialistic, too much outer self-conscious, that is role conscious or body conscious or religion conscious, we lose this inner energy. So then more ego and attachment comes in. And that creates, separations in our.
So in the time that we have left, how do we break that addiction
Yes.
to those things that don't serve us well, that keep us constricted and small?
So that is what, that is what so first day I got this vision that this outer self-consciousness, leads to limited or tubular vision, in which I see myself only and my wife, my spouse and my son and my close relatives and my interests. That's it. So I see the world through a tube.
Yes.
And that is what makes us divide this universe, divide the relationships, the yours and mine. And that heart doesn't want this. Heart wants universal. Heart wants unique. Heart wants no conditions, right? And that is what, see, this heart, what we talk in poetry and ghazals and in songs and in movies, not about this heart. We talk about this heart.
Yes.
The consciousness. That is the real heart, conscience. That is whatever, that whatever we have in the consciousness, if something happens through that consciousness, that affects this heart. So if I have some human being in my consciousness, or my body in my consciousness, I become body conscious, or I become role conscious. I'm a doctor. I am with this status, right? And someone damages that status, someone hurts that status, right? Or something happens to my body in whatever way, or material. Suppose my material comes into my consciousness. Whatever money, things I suppose I have in my consciousness. I'm too much attached to that. If something happens to that money, or some building, or my car, or something which I sort of feel that it is part of me,
yes,
attached to. So that affects my heart. And it starts happening from my childhood, from the age of 4 or 5 years. And those hurts which are here, the past psychological and emotional hurts which happened to me in the young childhood, keeps on affecting my heart. The certain areas here, the certain thoughts will keep on damaging that very aspect of, that little aspect of inner lining of the blood vessel.
So how do we change those thoughts?
So that is what first day, and second day I got the how to dissolve those past injuries and past emotional, psychological and emotional hurts, how to dissolve that through meditation. So meditation means to heal.
To heal.
Meditation word has come from medari. Medari means to heal. So meditation basically means healing. So 90% of our thoughts in the present, they're coming from the past psychological emotional hurts or future insecurities. So what meditation does to you, it heals the past psychological emotional hurts and future insecurity. So you start staying in the present. And present also, you understand what is present.
Yes.
So meditation teaches us to be in the present and heals the past and future, right? So that is how the past and future is healed. and we come to present, and our number of thoughts become much less, and that is called as peace.
Wow. Well, Doctor, we are out of time, unfortunately, but I always ask every person that I speak with, I used to do a program called Vision for a Better World, and that would be the last question I would ask. Dr. Gupta, what is your vision for a better world? And I think I know your answer, but I'd like to hear it again.
See, my vision is that everyone in this universe has a right, has a birthright to be healthy and to be happy. And healthy is one's own responsibility. Healthy means heal thyself. That means there is only one person in this universe who can heal you. It's not the doctor, it's not your parents, it's not your spouse, it's not even God. It is the only one, you, who can heal you.
Physician, heal thyself.
Heal thyself. And even everyone, it's made for everyone. And then when I say healthy, healthy also means swasth. In Hindi we call it swasth. Swa means inner self, stha means conscious. So that is possible only by leading an inner self-conscious approach. That means being conscious approach. I am a being with the human body. I, the being, make the body function with energy of peace, love, happiness. What is peace? Peace is dwelling in only positive thoughts, truthful thoughts. Love is unconditional, dignified, respectful care for everyone. Happiness is beyond senses, super sensuous feeling of joy. That is, sensuous joy is making us diseased, making us peaceless, making us loveless, making us unhappy, making us addictive.
Yes.
Right? So once you start enjoying the real joy, which is beyond senses, that will make us healthy and happy, and then wealthy as well.
Well, just being in your presence makes me more peaceful. So, Dr. Gupta, thank you so much for taking time.
Thank you.
And again, this study, Madhuban Open Heart Trial, is well worth reading. It's so well respected around the world. And again, thank you so much for being with us today. Om
Thank
Shanti,
you so much.
my friends.
Thank you.
Thank you.
Thank you so much.
I'm Michael Moran, and I want to thank you for tuning in and encourage you to read this wonderful study that Dr. Gupta directed called the Mount Abu Open Heart Trial. It's well worth reading. God bless you all. Om Shanti.